Hey, how's it going, everybody? This is Ron here on Humanize, the Humanize channel. In this episode, I'm going to talk about a condition called perinatal depression. Perinatal depression. But before I get into that, I just want all of you to know that, yeah, I am your friendly online attentive listener slash life coach. If you have any kind of obstacles in your life and you need to talk about it, I'm the person to call. All right. You don't have to go to those online, those other online websites. You can if you want, but I'm totally more personalized. I'm Uncle Ron, man. I have a heart. I'm better than those people. Seriously. No, I'm just kidding. Those people are licensed therapists and psychologists. I'm more of the everyday listener. Just imagine I'm like one of your buddies. I'm your friend, the trusting uncle that you can vent to. That's what I am, attentive listener. And what it is also a life coach. But here's the thing: to be a therapist, you got to go to school. You got to get your license, and every state mandates that. That's how they can practice those those therapy sessions and whatever. For me, what I do, I don't need to be licensed like that. I need a business license, and that's about it. And take, just basic online courses to learn about listening. But I've been listening to people for like 20 something years. And by just listening, it offers my clients, who a lot of them were like people I knew, it offered them relief. Some of them, they just wanted to talk about their everyday life. They just need to vent. Something was all bottled up inside and they just needed to let it out. Some people had dreams. They wanted to retrace their lives, their past lives, and they got older and they wanted to, revisit those old dreams and try to live again. And I coached them through it. One guy wanted to play golf again, and I'm not a golf coach, but he came to me because he had so much in his head, so much going on. He was raising his kids. His kids went to college, and he was older. His body got out of shape. He had a beer belly and all that. So I just talked to him for like, several sessions, and I just got him focused on changing his lifestyle and chasing his dreams of, playing good golf. He wasn't a pro or anything, but because he was raising a family, he couldn't even be like a weekend golfer. So it's like 18, 20 years he couldn't play golf. And by the time he was in his late 40s, but I did a thing with him called, just visualization. We went to the driving range, and I didn't tell him how to hit the ball because I'm not a professional golfer, but I just talked about visualization and have him just think about the shots and making sure that he follows through with all his plans that I helped him form to get better at golf. And he even took professional golf lessons. So as a listener and life coach, I didn't coach him on his golf swing, but kind of gave him the guidance to get to where he needed to be as a golfer, a weekend golfer, all right, an amateur. So he was shooting in the hundreds, and he goes, "Hey Ron, just because of what you're telling me, the mental aspect of it, and just listening to me talk, this is what he was telling me." He goes, I practiced that visualization and all that. And the funny thing was, he was a football coach before, so he knew about coaching, but he needed coaching. So that's where I came in. And life coaching, listeners, we don't need a psychology degree. However, if you hire me to just listen, you just got to vent about life, I'm there for you. We can do a Zoom meeting, FaceTime if you got Apple, WhatsApp video messaging, or Facebook messaging. We can do that, or just over the phone. At the end of this video, I'll give you all my information that you need if you want to hire me, and I can do you wherever you are, any part of the world. With the technology, we can use the technology we got. So I can do that. That's what I do, and I'm focused on helping people understand what other people might be going through in life on this podcast. Humanize, right? Humanize. We need to humanize ourselves. Humanize ourselves. And a lot of women talk to me about whatever issues they're going through. Again, if it's really serious, deep depression, anxiety, I'm not the one to hire. You need a doctor. See your doctor. Hire a professional therapist if you're in deep depression and anxiety. But if you just need to talk because you're depressed and you just want to get something off your chest, yeah, you can hire me. I can listen to you. You know, everyday life is getting you down or whatever. You can hire me. I can listen to you, but I have to really listen and key on what you're saying, because if you're talking about like really deep depression and you can't function, then I'll cut the session off and have you see your doctor, because again, I'm not trained to deal with somebody in deep depression or different kind of psychological issues, that kind of thing. All right. But you know, if you just life is getting you down and you might have like really mild depression, mild anxiety, and you just want to talk about, you know, hey, these people bugging me at work, and these guys at work making me depressed, you know, I can talk to you, sure. But if you really need help, you need to be medicated or something, and you probably would know that, and I can spot that. I'm trained to spot those things from life coaching. If it's really severe, I can't help you. That's it. But if you just need to vent, you got a goal in life, I'm the person to call. All right. I don't take insurance, but I'm reasonable. We can work out a payment plan. All right. At the end of this video, we'll talk about that. But we're going to talk about some things like on my podcast, or what people going through, so that you might be going through certain things, or you might know someone that's going through the subjects I talk about. All right. So I'm going to talk about perinatal depression. Okay. So let's go over that. And this is for women get these. All right. Let's be clear. Let's be very clear that women, biological women, okay? I know I might get blasted for this, but I'm just saying the truth, okay? I'm not going to get political, but this is medical facts, okay? So perinatal depression, okay? So perinatal depression is a mood disorder that occurs during pregnancy and after childbirth. The symptoms can range from mild to severe. In rare cases, the symptoms are severe enough that a mother and her baby's health and well-being may be at risk. Okay, so perinatal depression can be treated. Learn about the signs and symptoms, risk factors, treatments, and ways you or a loved one can get help. So what is perinatal depression? Perinatal depression includes depression that occurs during pregnancy, prenatal depression, and in the weeks and months after childbirth, postpartum depression. Most episodes of perinatal depression begin within 4 to 8 weeks after the baby is born. Pregnant and postpartum women with perinatal depression experience extreme sadness, anxiety, and fatigue that may make it difficult to carry out daily tasks, including caring for themselves or others. Okay. How is postpartum depression different from baby blues? All right. Baby blues is a term used to describe a mild and short lasting mood changes and feelings of worry, unhappiness, and exhaustion that many women experience in the first 2 weeks after giving birth. Babies require around the clock care, so it's normal for new mothers to feel tired and overwhelmed sometimes. Mood changes and feelings of anxiety or unhappiness that are severe or long lasting or lasting longer than 2 weeks after childbirth may be signs of postpartum depression. Women with postpartum depression generally will not feel better without treatment. So, what are the signs and symptoms of perinatal depression? All right, so some women experience a few symptoms of perinatal depression, while others experience several symptoms. Some of the more common symptoms include persistent, sad, anxious, or empty mood most of the day, nearly every day for at least 2 weeks. Okay, so feelings of hopelessness or pessimism, feelings of irritability, frustration, or restlessness, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, fatigue or abnormal decrease in energy, being restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, even when the baby is asleep, waking early in the morning, or oversleeping, abnormal changes in appetite or unplanned weight changes, physical aches or pains, headaches, cramps, or digestive problems that do not have a clear physical cause and do not go away with treatment. Trouble bonding or forming an emotional attachment with the baby, persistent doubts about the ability to care for the baby, thoughts of death or harming oneself or the baby, or suicide attempts. Okay, I'm going to stop right there. So, if someone is suffering from perinatal depression, I wouldn't be the person to talk about it, but I'm just giving you a gist of what it's about. So, someone like this, a woman like this, would not contact me. If they do, I would refer them to a licensed therapist, or have them talk to their primary care doctor. However, if someone is related to a woman like this suffering from this, and this person just needs to vent about it, maybe it's the husband. For the husband, he's just frustrated and needs to talk to somebody, then hey, yeah, I can deal with that. However, if the husband is also depressed and showing signs of, like, suicide or really, really deep sadness, then it's not me. I just got to be honest with you. I'm just an attentive listener slash life coach. These types of psychological issues isn't on my surfboard, man. I'm not gonna ride that wave. All right. So I'm just, like I said, giving you the gist of what the perinatal depression is and the signs of it. So, what is postpartum psychosis? So, it's a postpartum psychosis is a serious mental illness that can occur after childbirth. Women with postpartum psychosis may experience delusions, all right, thoughts or beliefs that are not true, hallucinations, seeing, hearing, or smelling things that are not there, mania, a high, elated mood that often seems out of touch with reality, paranoia, and confusion. Postpartum psychosis is a psychiatric emergency that requires hospitalization. Women experiencing symptoms of postpartum psychosis should seek immediate help by calling 911 or going to the nearest emergency room. Recovery is possible with professional help. And that's what I was getting at, guys. This kind of stuff ain't for Ron Sambrano, your friendly, attentive listener and life coach, right? Nah, see a professional. What are the risk factors for perinatal depression? Perinatal depression is a medical condition that can affect any pregnant or postpartum woman, regardless of age, race, ethnicity, income, culture, or education. Woman is not to blame for blame or at fault for having perinatal depression. It is not caused by anything she has or has not done. All right. Perinatal depression does not have a single cause. Research suggests that genetic and environmental factors contribute to the disorder. Specific factors contributing to perinatal depression can include life stress, for example, demands at work or or experiences of past trauma, physical and emotional demands of childbirth and caring for a new baby, changes in hormones that occur during and after pregnancy. In addition, women are at increased risk for perinatal depression if they have a personal or family history of depression or bipolar disorder, or if they experience depression with a previous pregnancy. Women with a history of perinatal depression should consult a healthcare provider to develop a plan for follow-up care in case a depressive episode reoccurs. How is perinatal depression treated? Treating perinatal depression is critical for the health of the mother and her baby, as the disorder can have serious effects on both. However, with proper treatment, most women feel better and their symptoms improve. Treatment for perinatal depression usually includes therapy, medication, or a combination of therapy and medication. Researchers continue to study treatment options for perinatal depression. A healthcare provider can explain the different treatments and help you choose the best one based on your symptoms. All right. Psychotherapy, several types of psychotherapy, also called talk therapy or counseling, can help women with perinatal depression by teaching them new ways of thinking and behaving and helping them change habits that contribute to depression. Evidence-based therapies for perinatal depression include cognitive behavioral therapy and interpersonal therapy. All right. Cognitive behavioral therapy, or CBT. With CBT, people learn to challenge and change unhelpful thoughts and behaviors to improve their depressive and anxious feelings. People also learn different ways of reacting to situations. CBT can be conducted individually or with a group of people who have similar concerns. Interpersonal therapy, IPT. IPT is based on the idea that interpersonal and life events impact mood and vice versa. IPT aims to help people improve their communication skills within relationships, form social support networks, and develop realistic expectations to better deal with crises or other issues contributing to their depression. Okay, I'm just going to add to that. Now, you might have heard me talking about the talk therapy. The therapist is going to try and guide them to change their thinking or their habits, if you will. And you go, hey, Ron, isn't that what you do as a attentive listener and life coach? Yeah, kind of, but not in a severe case like this. I won't touch a subject like this because this calls for a very trained, skilled person that knows medication, that knows the body, the biology, physiology, psychology, and everything. The therapist that takes care of these people are trained. They are highly skilled, and that's not, like I said, I don't surf that wave. These are like for the big dogs. That's it. Okay, so yeah, I think you get the gist of what I can do and I can't do. All right, so medication. All right, so medication, again, medication. See, I can't offer advice on medication, but let's talk about medication. So medication used for depression, antidepressants, can effectively treat perinatal depression when used alone or in a combination with psychotherapy. Antidepressants work by changing how the brain produces or uses certain chemicals involved in mood or stress. Antidepressants take time, usually 4 to 8 weeks to work. Problems with sleep, appetite, and concentration often improve before moods lift. It is important to give a medication a chance to work before deciding whether it is right for you. You may need to try several medications to find the best one. The U.S. Food and Drug Administration, the FDA, has approved a medication called brexanolone. Brexanolone. I hope I said it right. It's called brexanolone. I think I said that right. Okay, so anyway, specifically to treat severe postpartum depression. Brexanolone, which is administered through an IV during a brief hospital stay, appears to work differently than traditional antidepressants by rapidly altering a brain chemical that may play an important role in regulating the body's vulnerability to depression and anxiety. More recently, the FDA approved a pill called zuranolone as the first oral medication for postpartum depression in adults. Zuranolone acts on similar brain receptors to brexanolone. In clinical trials, the pill reduced depressive symptoms in women with severe postpartum depression more quickly than traditional antidepressants. All right. Note: in some cases, people under 25 years may experience an increase in suicidal thoughts or behavior when taking antidepressants, especially in the first few weeks after starting or when the dose is changed. The FDA advises that patients of all ages taking antidepressants be watched closely, especially during the first few weeks of treatment. The risk of birth defects and other problems for babies of mothers who take antidepressants during pregnancy is very low. However, women should always let a healthcare provider know if they are pregnant or nursing and work with a provider to minimize the baby's exposure to medication and weigh the risk and benefits of available treatment options. Find more information on medications during and after pregnancy on the FDA website. Okay, I'm going to cut it right there because I'm running out of time. We can talk more about perinatal depression. Maybe I can interview a doctor or something. But this is just, like I said, something that we can learn together. Maybe someone you know went through this. Maybe a husband and wife has been through this, or a family experienced this with one of their loved ones that got pregnant and gave birth and became depressed. So, these issues that I'm bringing out may not affect you, but hopefully it's going to help somebody. All right, that's all I'm doing right now. Again, I'm not making any money off these podcasts the video podcast that I'm doing. But if you feel this humanized channel that I got is worthy, I do accept coffee funds. You can buy me a cup of coffee. I got my Venmo app address right here. Just type this in. This is my Venmo. You can buy me a cup of coffee. It help me keep this podcast going. All right. Okay, and here's my Cash App address. If you want to buy me a cup of coffee, my Cash App address. All right. See that? Okay. So anyway, this is it for the perinatal depression episode. Hopefully, if you know someone, a woman going through this, or a husband and wife going through this, pray for them. And there's nothing wrong with prayer. Like I said before, there's nothing wrong if you believe in God, if you believe in prayer. I got no problem with that. If someone has a problem with that, then hey, that's their problem. But anyway, hope everybody's fine. And if you need to contact me, if you need an attentive listener and life coach, again, nothing like what I read. What I read is for the big dogs. It's for the professionals that went to university and got their degrees. That's not me. I'm a attentive listener, the everyday listener, life coach, help you weave around your obstacles of everyday life. But something like this, serious stuff for the big dogs. All right. I'm Ron Sambrano, attentive listener slash life coach. If you do need my services, my email's gonna be after this. Take care. Be good.